Have you ever heard about residency and fellowship programs for nurse practitioners? You might know that physicians usually go through residency and fellowship programs after they graduate medical schools, and residency and fellowship programs for nurse practitioners are not so common yet, but many institutions started fellowship and residency programs in recent years. In this episode, I'm going to go over the differences and common features of a fellowship and residency programs for nurse practitioners. Hi, we're gonna get into today's topic in a minute. But before we're gonna dive into today's topic, I just wanna mention that we are giving out free access to our online workshop. This workshop is about confidence. We had this workshop and we got so many good responses, feedbacks from the audience. So I wanted to give it out to more people so that you can boost your confidence and get more career opportunity, get into your dream nurse practitioner programs, and get pay raises. How you can sign up and how you can get access to this workshop is go to a website, usa.jnpproject.com/confidence. Again, usa.jnpproject.com/confidence, and sign up for our free email list. This is a 90-minute online workshop. You can watch it as many times as you want. It also comes with a handout of the slides that I used in the workshop. Again, a lot of people loved it. It really helps to boost your confidence. So I want you to have the opportunity. So please sign up. All right, let's get into today's episode. So today's episode is about what are the differences between residency and fellowship programs for nurse practitioners. So you might or may not have heard that there are some residency and fellowship programs for nurse practitioners. You might not heard about it before because it's not that common for nurse practitioners to go through residency and fellowship programs after they graduate nurse practitioner program. Yet, this is kind of a new thing. Physicians usually, after they finish medical schools, they usually go through residency and also, sometimes fellowship, depends on the specialty. But many institutions have started residency and fellowship programs for nurse practitioners also. And in this episode, I want to go over some common features and also differences between residency and fellowship programs, and the pros and cons of go through that program versus just jump into a nurse practitioner job right after you graduate from nurse practitioner school. So first of all, residency program and fellowship programs are postgraduate programs. Both are postgraduate programs. Nurse practitioners, students graduate from their program and they can choose to go through either residency or fellowship. Usually, first of all, it's optional. You don't have to, at this point, you don't have to go through residency program or fellowship program. It's not mandatory to be able to work as a nurse practitioner. You have to just graduate from a nurse practitioner program. You have to pass a certification exam and then get licensed from Board of Nursing in the state that you want to get licensed. So you don't have to go through residency or fellowship programs at this point yet, at least. But you can choose to go through residency and fellowship programs. So it's optional. It's not mandated, but this is a program you go into after you graduate from a nurse practitioner program. So generally, these programs are for newly graduated nurse practitioners. Some programs are also for people who've been nurse practitioners for years, but majority, especially for residency program, they are aimed for newly graduated nurse practitioners. So during these fellows residents or fellows usually get trained under supervision of specialists, physicians, or senior nurse practitioners who are specialized in the field, and deepen their clinical knowledge and skills that they couldn't master during the nurse practitioner programs. In the United States, nurse practitioner programs are usually 2 years, depends on the program, 2 to 3 years. So, it's such a short period of time to master so many different things. And even if, the student have a lot of nursing experience, being a provider there are a lot of differences to become a healthcare provider, making medical decisions, deciding on diagnosis, treatment plan, prescribing medication, refer to specialists. So there are different roles, from nurses' roles. So learning for 2 to 3 years during nurse practitioner program may not be enough to be efficient, independent nurse practitioner right away. So that's why there are these programs. So let's go over residency programs first. So like I said, both of them are postgraduate program. And for the most part, residency programs are usually for newly graduated nurse practitioners who want to gain more clinical experience within their field. So meaning that, if you graduate from family nurse practitioner program and, you might get into primary care residency program so you can have more clinical experience. Remember that for master's students, medicine students, need to get at least, it's not like just 500, but at least the minimum 500 clinical hours. And then for students who go into doctorate program, DNP program, they need to have a minimum of 1,000 clinical hours. That sounds like a lot, but especially for those who don't have any nursing experience in the past, or, maybe there are some auxiliary programs that never worked as a nurse before, but now they're trying to become a nurse practitioner and they feel like they are not confident to become a nurse practitioner right away after graduating. Or for foreign trained nurse like myself, who worked as a nurse outside the United States and have a good clinical experience and skills, knowledge, but you are not too familiar with working in healthcare in the United States, so that you might feel like I need a little bit more training before I can be independent and feel confident in what you do. So these programs might be more helpful, especially for those who have no or little nursing experience or who are foreign trained nurses like myself. Residency programs are usually consist of didactic session, meaning that you sit in a classroom and then you learn, maybe the lecturer use their PowerPoints or slides and then you receive lectures. So it's like you're going to a nurse practitioner program, you learn, and also you do rotation in a different specialty, depends on the residency program. But you go around different clinical sites to have more clinical experience. And so you might wonder, like, whoa, that sounds like being in a nurse practitioner program. What's the difference? It seems exactly the same. Yeah, so the difference is when you are in a nurse practitioner program, you are a student. So you don't have a patients on your panel. So, you might take some history from your patients. Well, not your patients per se. You might take histories from patients of your preceptors, rather. You might do physical exams. You might make a plan for patients. But those patients are actually under your preceptors. So you don't have ultimate responsibility. You're learning under preceptors. And for the residency program, residents actually have their own patients. They're licensed, so they're already, those people are supposed to have a license already. They are nurse practitioners. They can prescribe on their own. They can diagnose on their own. But they do have some supervisors, they might call it preceptors. They have some supervision, but ultimately patients are theirs for residents. So a little bit of the where the responsibility sits is different. When you are in nurse practitioner programs, you are, doing some stuff for your preceptors' patients. But when you are residents, you actually have your own patients, but you get some supervision. So you're not like totally on your own. Like you just jump into a nurse practitioner job and then work. You have somebody that you can ask questions, get supervised. So that's the difference between being a student in a nurse practitioner program versus being a resident for a nurse practitioner residency program. So, and then again, you get the on-the-job training with supervision from your preceptors and mentors. So compared to fellowship program, which is also postgraduate program, these programs, residency programs, are not specialized into a specific field. So for residency programs, usually it's more like the population based. So it can be, a rural area. It can be primary care. It can be acute care. It can be pediatrics residency program. But the field is usually defined by the population of the patients that you're going to see. So that's the difference. Versus, I'm going to say this again later on, but for the fellowship program, it's more specific to like organ system or like a medical field. So it can be like gastroenterology or neurology or ER or critical care or hospice care or transplant. So it depends. It's different for residency program. It's more population based versus fellowship program. It's more like a different organ system or medical field. It can be dermatology. And in a fellowship program, you're specialized. You go really deep into that field. So now we talked about the residency program, so we're going to go over what fellowship programs are. So like I said, people or fellows in the fellowship programs get trained in a specific specialty beyond nurse practitioner, basic nurse practitioner training in a nurse practitioner program. Because when you're in a nurse practitioner program, let's say you are in a family nurse practitioner program, like I'm a family nurse practitioner, and you do different rotation. You go to, you get adult medicine education, geriatric education, you go rotation for pediatrics, you go rotation for women's health. And I think these days people go for behavioral health, training, which is wonderful. So you kind of, especially if you're a family nurse practitioner, you kind of go through a little bit of everything. But so your knowledge is wide, but also kind of shallow because you have very limited time to go through different rotations. So you get to know a little bit of each field, but your knowledge, the depth of your knowledge is, relatively shallow. But when you get into fellowship program, you will learn beyond what you learn in the nurse practitioner programs. So, examples of fellowship programs are, like I said, it could be gastroenterology, cardiothoracic surgery, or emergency, hospice palliative care, transplant. Especially these like cardiothoracic surgery, that's not what you would learn in a family nurse practitioner program. But because you have a good foundation you built during a family nurse practitioner or rather acute care nurse practitioner programs, and you have a basic knowledge, and now you can go beyond. So you get trained more specialized knowledge and skills in specific field. So fellowship programs also consist of didactic sessions, meaning that you sit in a classroom and learn, and also stimulating training and on-the-job training under guidance of experienced specialists, can be physicians or can be senior nurse practitioners, or it could be physician assistants. And compared to residency program, again, the focus of fellowship is narrow. It's not population-based like a residency program. It's based on the specialty. Like transplant is very specialized field, but you specialize in, you go really deep in that transplant field. So I'll give you some examples, so that might be easier for you to have a good image of what fellowships are. So for example, there is a cardiothoracic surgery fellowship at Atrium, I'm hoping that I'm pronouncing this correctly, Health in North Carolina. So on the website it says this program trains nurse practitioners and physician assistants to assist in cardiothoracic surgeries, surgical procedures. So you're going to be assistant. You're not going to be the main surgeon. The main surgeons will be like, cardiac surgeons and stuff like that. But you're going to be assistants in these surgical procedures when during the program and after you graduate from the program. And you participate also in a perioperative, meaning that before, do the pre-op and then post-op care of cardiothoracic surgery population. This program is 12 months program. And who can apply for this program? They said either adult gerontology, acute care nurse practitioner, or physician assistant. So family nurse practitioner cannot apply, which makes sense because if you're gonna be like actually in the surgery, take care of these critically acute care, you want to have a good basis of acute care, and that's why for us, the family nurse practitioners, we're usually trained to work in a primary care. So we're not specifically trained to work in acute care. So I think that's why they say who can apply, either adult gerontology, acute care nurse practitioners, or physician assistants. And then, you need to graduate from master's program. So you don't have to have DNP degree. And for this, the website didn't specify that, you have to graduate from nurse practitioner program within the last 2 years or 1 year. So I guess that, my assumption is if you are acute care nurse practitioner and interested in specialize in the cardiothoracic surgery, and you actually already have years of experience as acute care nurse practitioners, I assume that you can apply for this fellowship still yet. So they didn't specify that this is only for newly graduated nurse practitioners, which makes sense. I'll give you another example. So emergency medicine fellowship by University of California, San Francisco. So this is a 12 months transition to practice program for newly graduated nurse practitioners and physician assistants. So this program, on the other hand, specify that this is transition to care. So this is specifically for new grads. So, folks like myself who have been working as a nurse practitioner for years cannot apply for this program. I think this is very interesting, although I'm not a candidate for this program. But being a family nurse practitioner, I graduate from family nurse practitioner program, I didn't feel like I was trained well enough to work at an emergency care because most of the training was focused on primary care. So it's different from emergency care. So if someone is interested in working at the emergency care, it might be a good idea to get into these fellowship programs specialized in emergency care, because it's also you need additional knowledge and skills to be efficient provider at emergency care. So for this program on the website says you need to have master's degree or doctorate degree. So again, you don't have to have BNP degree. And who can apply for this program? They said adult gerontology, acute care nurse practitioner, adult gerontology, primary care nurse practitioner, or family nurse practitioner can apply. And then you need at least 3 letters of recommendations to apply. That includes one from clinical preceptor. So this is kind of a side note, but if you are thinking of going to nurse practitioner program, or if you are a student at a nurse practitioner program, make sure to have, well, first of all, that's why you need to prepare. I made an episode about how to prepare for clinical rotation, and so that you can perform well during the rotation, because building up career starts from there. You might think that, well, I'm just going through school, and then after I graduate, then I can start building my career. But it actually starts during the clinical rotation, because like this one too, if you don't give good impressions to your preceptors, and you actually notice, oh, I need a letter from my preceptor to apply for this fellowship program, but you didn't perform well during clinical, you might not be able to get a letter of recommendation, or your letter of recommendation is not as strong, because we nurse practitioners also have responsibility of who to recommend, because we also want to make sure the integrity of this profession. So, definitely you want to perform well during rotation. How you do that? Well, you have to prepare well before clinical training. So, and I'm going to put the link below on the comment section if you haven't watched how to prepare for clinical rotation episode. But yeah, prepare well for clinical rotation and perform, well during the rotation, and also send a thank you letter or on the last day, maybe bring a little snack and thank you note. And you might want to mention, like, if I need a letter of recommendation for my, to apply for a job or apply for residency program or fellowship program, may I ask you for that, and then you get a contact number or email address. And one thing you can also do, which I actually did, and that's how I got my first job, is when I was graduating from nurse practitioner program. And I think I was before graduation, but I finished the dissertation, I finished everything, and I was sure that I'm graduating. I went back to my preceptor with a little snack, with a little thank you note saying, thank you so much for teaching me then. Thankfully, I'm able to I'm graduating now, and I'm so thankful. And then she said, well, did you find, I'm happy to help you to find your first job. I'm not hiring any nurse practitioners at this point, but, I would love to help you with finding a job. And then she actually asked around her colleague OBGYNs, and then that's how I got my first job. So, just make sure to keep the connection. Okay, so that was a little side note about a little recommendation and, clinical rotation. But anyway, so that was another example of a fellowship program. So you might have some questions about, the fellowship programs and then residency programs from nurse practitioners. So like, how long are these programs? So usually it's less than 1 year. As far as I saw, it's usually less than 1 year. And what's the pros and cons of residency fellowship programs? So pros are, if you go through these programs, residency and fellowship programs, nurse practitioners would feel more confident because you have more experience, more hands-on training before you they become independent providers. So they probably feel more confident when they start practicing on their own. And again, this is particularly important if you don't have any nursing experience, or you were a nurse outside the United States, but you don't have much experience in the United States, and you feel less confident in yourself yet. So that's one of the pro. Another pro of going through these programs is you can be more marketable, especially, if you, when you apply for a job, if you say, well, I graduated from this nurse practitioner program and I successfully went through residency program or fellowship program, employers will see that, oh, you're well trained, you must be very good. So you might have more chance to get a job. Also, if you want to work in a cardiothoracic surgery field, if you went through the fellowship, you're more likely to get hired than folks who just graduated from nurse practitioner program but didn't have a specific training for cardiothoracic surgery. And another pro would be more income after graduate because you're more specialized. This is particularly for fellowship program graduates because you are special. There are not many specialists in that particular transplant and cardiothoracic surgery. So you might be able to get more income because you are very specialized. On the other hand, cons of going through residency and fellowship programs are when you're in those programs, you probably have less income than your classmates who just start work as a nurse practitioner right away at an urgent care or somewhere else, because usually when you are in those fellowship residency programs, you see less patients, so you are rewarded less. Usually you get paid. The pay is less than normal nurse practitioner pay, but it's only for 1 year. And also, if you are going through the specific fellowship programs like cardiothoracic surgery or transplant, and you move to some other areas, like let's say you are trained for cardiothoracic surgery, you went through the fellowship, and then you had to move to, let's say, island of Kauai in Hawaii, and which is considered rural. You might, depends, but you might not be able to get a job in the different community because you're too specialized in the field. So it might be hard to utilize your skills and knowledge in the specialty if you move to other community and the need for the specialty is not there. So that can be a little tricky. So narrowing down your specialty can be, risky to some extent. So you have to kind of think about that risk. If you are generalized, like family nurse practitioners, you can work in so many different areas. Then, even if you move, likelihood is there's always a job that you can work because you're not too specialized. So there's pros and cons. Is it difficult to get into those programs? Yes, it is. Because not all states have residency and fellowship programs. And because of the funding issues, usually the seats are very, very limited. So I work at a federally qualified health center in Hawaii, and there's so many nurse practitioners, but I think usually they accept 3 to 4 residents per year. So, being selected is very competitive. So not all graduates from nurse practitioner programs in Hawaii can get into these residency programs. There's no fellowship programs there is a fellowship program in Hawaii. But yeah, so anyway, so it's hard to get in to those programs. So another question you might have is, which programs should I choose? Which program I want to get postgraduate education. which should I go into residency program or should I go into fellowship program? Well, it depends on what you want to do. If you are so it depends on, do you want to specialize or do you want to have a general training and to be able to change your specialty if you change your mind later on? Or you're like hardcore cardiothoracic, you really want to, involve in surgical procedures, and you really want to do that, maybe you want to go into those fellowship programs. But if you are flexible or you're not sure which field that you want to specialize in, then might be good to get into residency program because it's generalized. And again, you want to consider employment opportunities, not only for now, after you graduate, but also for the future. Are you going to be marketable? Like marketability is one thing to think about, but another thing is your pay. If you are super specialized and there is a need for the specialist, you probably get paid more than generalist nurse practitioners. So there's a lot of things to think about. Okay, so I'm hoping that this episode was helpful. I'm planning to interview nurse practitioner who is currently in a fellowship program in Hawaii, who was a student that I taught before, and she's very excellent. She was very excellent and very excited to interview her. So that will be coming up in a few weeks or so. But yeah, you can hear how it is to be a nurse practitioner in a fellowship program. But if you have any requests for topics for future episodes or any questions, opinions, please comment down below, and then don't forget to give me a thumbs up. That would be very, very appreciated. All right, have a great day. Aloha.